Hello, and welcome to this patient information video on recognising and treating hypoglycaemia. Hypoglycaemia is a condition that occurs when your blood sugar levels drop below normal. For your diabetes, you may be prescribed medication, such as insulin, that could cause hypoglycaemia. There are other causes of hypoglycaemia, and if you're experiencing an episode, it is important to determine the reason, and your healthcare provider can help you with this. The symptoms of hypoglycaemia can vary from person to person, but some common ones include feeling shaky, sweaty, dizzy, confused and weak. You may also feel hungry and have a headache or experience heart palpitations. If left untreated, hypoglycaemia can lead to more serious symptoms such as seizures, loss of consciousness and even coma. To recognise hypoglycaemia, it's important to be aware of the symptoms. If you have diabetes, you may also use a glucose meter to check your blood sugar levels regularly. If your levels are below 4 millimoles, you're experiencing hypoglycaemia. If you're experiencing symptoms of hypoglycaemia but do not have your meter at hand, it's safer to assume you're having an episode and have some treatment. If you experience any symptoms of hypoglycaemia, it is important to act quickly and treat your hypoglycaemia. Here are some steps you can take. Check your blood sugar levels. If you have a glucose meter, check your blood sugar levels immediately. If your levels are below 4, you're experiencing hypoglycaemia. Treat your hypoglycaemia. Eat or drink something that contains sugar, such as a glass or carton of fruit juice, about 150 to 200 mils, a handful of sweets, such as 4 to 5 jelly babies or 4 to 5 dextrose tablets. Wait 10 to 15 minutes and then check your blood sugar levels again. If your levels have not risen, repeat the treatment. Eat a snack. Once your blood sugar levels have returned to normal and you're not planning to eat a meal within the next hour, eat a snack that contains carbohydrates such as a piece of fruit or bread. This will help stabilise your blood sugar levels and prevent hypoglycaemia from reoccurring. What to do if you experience a hypo whilst driving? If you're taking insulin or any medication that could potentially cause a hypo, you need to make sure you are safe to drive before setting off on your journey. You should check your blood sugar, and if it is 5 millimoles or above, you are safe to drive. If it is between 4 and 5 millimoles, have a small snack to bring your blood sugar to a safe level. If you are on a long journey, or in and out of your vehicle for a long period of time, you should check your blood sugar at least every 2 hours to ensure it is still at a level of 5 millimoles or above. If you experience a hypo whilst driving, it is important you follow these steps. 1. Pull over to the side of the road and stop the vehicle as soon as safely as possible. 2. Remove the keys from the ignition and move into the passenger seat. 3. Treat the hypo as previously discussed until you are no longer hypo. 4. You must wait 45 minutes before restarting your journey. This is because it takes this long for the brain to fully recover from a hypo. Ensure your blood sugar is 5 millimoles or above before setting off again. If you have been prescribed insulin, you must inform the DVLA. Be assured this does not mean you will lose your license, but you will have to renew it more frequently, for example every 3 years as opposed to every 10. We would recommend having the equipment to monitor your blood glucose levels and hypo treatment in the car with you throughout your journey. To prevent hypoglycaemia, it's important to follow a healthy lifestyle that includes a balanced diet and taking your diabetes medications as prescribed by your healthcare provider. It is important to check your blood sugar levels regularly and to always carry a source of fast-acting sugar with you. If you have diabetes, wear a medical alert bracelet or necklace that indicates you have diabetes and you are at risk of hypoglycaemia. In summary, hypoglycaemia can be a serious condition, but with the right treatment, you can manage it effectively. Remember to recognise the symptoms of hypoglycaemia, treat it promptly, eat a snack to prevent it from reoccurring, and seek medical help if necessary. And if you have any concerns, always speak to your healthcare provider.